If your period pain makes you miss work, miss school, or curl up in bed unable to move, you've probably been told this is normal. It's not. What you're feeling could be a real, diagnosable medical condition called endometriosis. And today, we're going to talk about it honestly, because too many people are suffering in silence, thinking their pain is just something they have to live with. Endometriosis is a condition where tissue similar to the lining of the uterus, called the endometrium, starts growing outside the uterus. This tissue can grow on the ovaries, the fallopian tubes, the outer surface of the uterus, and even on the bladder or intestines. Here's the problem. This tissue behaves just like the lining inside your uterus. Every month, it thickens, breaks down, and bleeds in response to your hormonal cycle. But unlike the tissue inside your uterus, this blood has no way to leave the body. It becomes trapped, causing inflammation, scar tissue, and in some cases, adhesions that bind organs together. This is why endometriosis pain is often so much more severe than typical period cramps. It's not just your uterus contracting, it's inflammation and irritation happening in places it was never meant to happen. The exact cause of endometriosis is still not fully understood, but researchers have identified several contributing factors. One leading theory is called retrograde menstruation, where menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. Genetics also play a role. If your mother or sister has endometriosis, your risk is significantly higher. Immune system dysfunction may prevent the body from clearing this misplaced tissue effectively. Hormonal factors, especially estrogen dominance, are also believed to fuel the growth of this tissue. It's important to understand that endometriosis is not caused by anything you did. It is not related to hygiene, and it is not something that can be prevented through lifestyle choices alone. This is the part everyone needs to hear clearly. Mild period discomfort is common, but here are signs that suggest something more serious might be happening. Pain that is severe enough to interfere with school, work, or daily activities is not normal. Pain that doesn't respond to over-the-counter pain relievers is a red flag. Pain during or after sex, pain during bowel movements or urination, especially during your period, chronic pelvic pain that isn't limited to your period days, heavy menstrual bleeding or bleeding between periods, and difficulty getting pregnant are all signs worth paying attention to. If you've been dismissed by people around you or even by a doctor and told to just take a painkiller and move on, please know that your symptoms deserve a proper investigation. Diagnosis usually begins with a detailed conversation about your symptoms and menstrual history. From there, a doctor may perform a pelvic exam to check for cysts or scarring. Imaging tests like ultrasound or MRI can help identify larger endometrial growths, though they can't always detect smaller lesions. The definitive diagnostic method is laparoscopy, a minimally invasive surgical procedure where a doctor inserts a small camera to directly view and often take a biopsy of the tissue. Because early imaging can sometimes appear normal even when endometriosis is present, many patients are misdiagnosed or dismissed multiple times before receiving proper care. This is exactly why self-advocacy matters. If your symptoms are affecting your quality of life, you deserve to push for further evaluation. There is currently no permanent cure for endometriosis, but there are effective ways to manage it. Pain management often starts with anti-inflammatory medications. Hormonal treatments, such as birth control pills, hormonal IUDs, or GnRH agonists, work by reducing or stopping the menstrual cycle, which can significantly reduce symptoms. For more advanced cases, laparoscopic surgery can be used to remove endometrial tissue and scar tissue. Lifestyle approaches like anti-inflammatory diets, regular movement, and stress management can also help some patients manage symptoms, though they are not a replacement for medical treatment. The right treatment plan depends on your specific symptoms, whether you're trying to conceive, and the severity of your condition, which is why working closely with a gynecologist who takes your symptoms seriously is so important. Endometriosis can affect more than just your body. Chronic pain can impact mental health, relationships, career, and fertility plans. It's common to feel isolated, especially when others can't see your pain and don't understand its impact. Connecting with support communities, whether online or in person, can make a significant difference. Tracking your symptoms can also help you and your doctor identify patterns and evaluate whether treatment is working. You are not overreacting. You are not being dramatic. Living with chronic pain and still showing up for your life takes real strength. If your period pain regularly stops you from living your normal life, it's time to talk to a doctor. If pain medication isn't helping, if you're bleeding heavily, or if you're struggling to conceive, these are all valid reasons to seek a proper evaluation. Bring a symptom diary to your appointment. Be specific and be persistent. If one doctor dismisses your concerns, it is okay to seek a second opinion. Endometriosis is common, it is real, and it is manageable with the right care. If this video helped you understand your body a little better, share it with someone who needs to hear it. And if you've been told your pain is normal when it doesn't feel normal to you, trust yourself enough to ask for answers. Take care of yourself, and we'll see you in the next video.